Thank you. I'm Ebony Siraj, and I thank you for joining us today. Before we began fighting the COVID-19 pandemic a year ago, our country was already at war against an epidemic. And though COVID-19 seems to have consumed our healthcare system, there are still other battles that plague our communities. My reason for sharing with you today is simply to increase your understanding of the issue of heroin and other opioids, so that we can come together to take action for our communities. This presentation was awarded by the Society of Public Health Education and funded by the CDC National Center for Injury Prevention and Control. It's developed a partnership between the partnerships of Drug Free Kids, SOFI, and the high intensity drug trafficking areas. I like to start with this quote because it really sums up what we're dealing with. It's the opioid epidemic is devastating American families and communities. To curb these trends and save lives, we must help prevent addiction and provide support and treatment to those who suffer from opioid use and disorders. The CDC didn't declare epidemics lightly, and they don't recommend actions without good reason. So today we'll talk about three aspects of the issue. First, we'll talk about the problem. How big is it and how did we get here? Second, what are opioids? How are they abused and how do they affect the brain and the body? Then we'll look at what our professional organizations came together and said about the opioid crisis. And finally, we'll look at what we can do, both as family members and members of the community. To be clear, there's no easy answer. There's no immediate solution to the problem. However, it's important that we work towards saving lives and reducing the use. And that work begins with education. Some of you may have been personally affected by heroin or other opioid use. For others, the opioid epidemic is something you've heard about on the news. But drug overdoses are now the leading cause of accidental death in the United States, exceeding deaths of automobile accidents. From across the nation, people, many of them young people, are losing their lives to opioid overdoses. There are many ways to look at those numbers, but imagine if a Boeing 737 crashed every 3 days in America. We would shut down airports and demand an overhaul of the entire airline industry. Well, that's the equivalent of the level of death and destruction that we're seeing with this epidemic. So faced with these problems, the question you may be asking are, how did we get here? How did this happen? There's a pretty simple formula that drives substance use. When availability of a drug increases and the perception of the risk is low, use tends to increase. The main driver in the past decades spike in opioid abuse and overdose is the greater availability of prescription pain relievers. Some of the latest CDC statistics show a continuous gradual decrease. However, it's still a major problem. There's also been a process where the use of pills drove increased use of drugs like heroin. Think of a ladder. At the bottom of the ladder, there's drugs like alcohol and marijuana. Among high school seniors, the perception of risk of regular use of alcohol is about 20% and regular use of marijuana is about 30%. The perception of risk of heroin is over 80%. It's seen as a pretty bad drug, but it was once fairly uncommon for young people to make the jump from alcohol to heroin. But what we're seeing now is that the opioid pills have added the missing rungs to the ladder. With a risk level of about 44%, young people made the transition from drinking and smoking to popping pills and then to using heroin. Here you can see the result. It's led to an increase of prescription opioid deaths, followed by an even sharper increase of heroin opioid deaths. There are many risks of opioid use, but a few to focus on are the fact that users never know what they're going to get. As we'll discuss, drugs are sold, such as heroin, may be fentanyl or something else. And fentanyl, which is 25 to 40 times as powerful as heroin, is driving overdoses from users who think that they're buying and using heroin, but actually getting something much more potent. Opioids are even more dangerous when they're consumed with other drugs. If you've had the opportunity to watch The Pharmacist on Netflix, you now know that the trifecta and common combination of prescriptions was Oxycontin, which is an opioid, Soma, which is a muscle relaxer, and Xanax, which is anti-anxiety medicine. Alcohol and sedatives compound the depressive effects of opioids. Stimulants such as methamphetamines and cocaine do not balance it out. The heart and lungs, they throw them into complete chaos. Underscoring the point that people don't know what they're getting. Alternatively, drug dealers may try to get a competitive advantage by increasing the potency of their product. The risk for users is that they get a dose that's much stronger than they expected. Illicit fentanyl is definitely on the rise, and this chart from the National Forensic Lab system shows the numbers have grown. So another way to look at it, a fatal dose of heroin is about 30 milligrams. But a lethal dose of fentanyl is only 3 milligrams. Due to difficulty of mixing fentanyl evenly, and the amount of fentanyl in different doses of heroin can vary significantly. As we've stated, there's no single simple answer, but there are solutions available that we can implement. Through prevention, by identifying people struggling with substance abuse and taking action early by preventing overdoses and by providing effective treatment and continuing care. So we've been talking about opioids, but what exactly are they? Opioids are chemicals that either produced from the opium poppy plant or created in a lab to have the same effect. And not all labs are legal ones. The picture at the top right shows a bust of an illicit fentanyl lab in Canada. Some opioids are medicines. Some are medicines that are produced illicitly. Some are illegal drugs. They're very similar at the molecular level. Opioids are used and abused in a number of different ways. They can be swallowed, broken down by the stomach, and take a little bit longer to reach the brain. They're snorted. Powdered heroin or pills can be inhaled through the nose. Heroin can be heated and the vapors are inhaled through the mouth, or it can be injected with a needle. Heroin can be added to a liquid, heated, and then shot directly into the bloodstream. This form of use is especially risky for a number of reasons. Shared needles leads to spread in HIV and hepatitis, and needles can damage veins causing abscesses, which can lead to bacterial infections of the blood and even heart problems. People use needles because it delivers the drug to the brain much more quickly than other ways of using it. There are a number of reasons why a person may start using. Every person's story is different, but these reasons overlap. They may get a prescription and then misuse their medication by taking more than they should, or taking it in a way they shouldn't. For example, with alcohol, or more frequently. They may start using pain pills, either through a prescription or recreational, then develop a tolerance and increase the amount that they're using to start using the pills in a different way. Many use it to cope with emotional stress, pain, or an untreated mental health issue. The shorthand for this is self-medicating. And for others, opioids are simply the next drug on the table. It may be a teen who drinks and smokes and has heard good things about pills, so they try them and they like them. excuse me, in the same way people start using for a number of different reasons, there are many factors that drive continued use. Again, everyone's different. Genetics and person's physiology play a major role. Two people can try the same opioid at the same time. One never touches them again. Another develops a substance use disorder. For opioids and other drugs, the body develops tolerance to use. They have to use more and more of a drug to get high, and eventually they don't even get high when they use, because the body's adjusted to having the excess opioids in their system. That keeps them using because they're in fear of withdrawal. Withdrawal's been described as the worst flu you've ever had. A user will feel physical aches, restlessness, anxiety for the first 24 hours. One effect of opioid use is constipation. So during withdrawal, the intestinal system opens up and the opioid users will have diarrhea and cramping and nausea. They may also have rapid heartbeat and high blood pressure. At the very basic level, withdrawal undoes everything that opioid intoxication does. And when the pendulum swings back, it can be very painful. If a user gets through the physical withdrawal, they may then experience emotional withdrawal, missing the feeling of being high. This can result in relapse, which means that users start using again. Relapse is dangerous because a user may go back to using the same dosage they did before they stopped using, but their body is not ready for it. Relapse often results in overdoses and death. This is a list of signs that can indicate an overdose. Most from the effect of opioids on the heart and lungs. As they slow down and weaken, the entire body can be affected. Blood carries less oxygen, which affects everything from skin color to responsiveness. Erratic breathing leads to choking sounds, which are appropriately called a death rattle, that can sound like snoring or choking. If you encounter a person who's experienced these effects, the first thing to do is call 911. Most naloxone kits contain 2 doses, but in some instances, 2 doses may not even be enough to revive a person from an overdose. It's important to note that naloxone, also known as Narcan, can reverse an overdose. However, reversing an overdose should be the first step to getting a loved one into treatment. Studies have shown that long-term opioid abuse can affect the brain, which may affect decision-making abilities, the ability to regulate behavior, and responses to stressful situations. These images of the brain are obtained using the single photon emission computed tomography, or SPECT. In the same way that X-rays show the hard substance within the body, SPECT gives a 3D image of activity within organs. The image on the left shows a 39-year-old with a healthy brain. The image on the right shows the brain of a person who's used heroin for 25 years. It's important to note that those are not physical holes in the brain. They are areas of the brain where activity is reduced. So we've been talking about opioids, but what's being done? DHH has introduced legislation which will fund prescription drug monitoring programs, research evidence-based opioid prescribing guidelines, and develop curriculum that will help healthcare practitioners. We can transition from a crisis framework to a sustainable long-term model, develop national infrastructure to track, study, and improve outcomes, and team up with multiple agencies to address the opioid issues from multiple angles, including professional healthcare organizations. Last year, AST, the National Board of Surgical Technology and Surgical Assisting, the Association of Surgical Assistants, and the Accreditation Review Council on Education in Surgical Technology and Surgical Assisting came together and developed a joint position statement. It's essential that as members of the surgical team, the CSTs and CSFAs are encouraged to be involved in community, state, and national efforts to address the opioid crisis. Research on prescription drug misuse has shown that the two most commonly reported sources of opioids are obtaining the drugs from a friend or relative and personal prescriptions. Therefore, CSTs and CSFAs, in collaboration with other healthcare professionals, should support efforts to educate family members, patients, and the community at large about the potential health consequences of misusing or sharing prescriptions, including the dangers of addiction and overdose. So what we need to do, what are some of the tools to get there? The first set of tools are for healthcare providers. They start in school. Many medical professionals get little training in addiction, medicine, and pain management. Understanding these issues is critical at this time when we as a society turn more and more to medications for solutions. Doctors, dentists, and other professionals also have a range of resources they can use, which include guidelines from the CDC, access to prescription drug monitoring programs, which can help identify individuals who may be seeking medications inappropriately, use of versions of opioids that are more difficult to abuse, and by considering non-opioid therapy, such as physical therapy where appropriate. Healthcare providers can also identify individuals, especially young people who may be going down a dangerous path with alcohol or other drugs. Medical professionals have a lot of credibility and have tools they can use to identify and help individuals who may be struggling with their use. Doctors can also play a significant role by offering medication-assisted treatment, which can reduce withdrawals and cravings, which make behavioral therapy all more effective. As a community, we can work together to expand access to medical-assisted treatment through licensed prescribers. The DEA, in collaboration with the FBI, developed Chasing the Dragon, a video for communities, and has also made Operation Prevention, a curriculum available to schools. The National Education Association has developed prescriptions for understanding, and the National Association of School Nurses has developed Smart Moves, Smart Choices. All of these resources can be used in schools to increase young people's understandings of the risks of opioid misuse. Community and law enforcement also have a number of resources. Community members can be educated through the programs like this one and other programs such as partnerships, out of reach video, and toolkit. The partnership has developed a guide to help communities dispose of unwanted prescriptions safely, and community leaders can advocate for expanded access to naloxone and adoption of effective Good Samaritan laws that protect those who act to save the life of a person, even if they're using themselves. Some of the greatest impact can come from families. And please note that wherever we say parent in this presentation, we mean anyone who cares for a child. And that work starts at home. If you're a parent or a grandparent or anyone who cares for a young person, I encourage you to get serious about substance use. A person who starts using alcohol or other drugs before the age of 15 is 5 times more likely to develop a substance use disorder as persons who start at 21. There are biological reasons for it. The human brain doesn't develop until about 24, 25. And it's that judgment that develops last once the brain's completely myelinated. That's the part of the brain that says, no, this is a bad idea, which becomes further impaired by substance abuse. Most kids who use drugs or alcohol will not develop an addiction, but all kids who use are putting themselves at risk. short-term risk of accidents, injury, or overdose, or simply bad decisions, and long-term risk of substance abuse disorders. While it seems like kids don't listen, parents can have the power to affect your kids' attitudes and behaviors around substance abuse. Kids who learn about these risks of drugs at home are significantly less likely to use alcohol and other drugs than kids who don't. 42% less likely when it comes to prescription drug abuse. And when kids are asked why they don't use, the answer is that they didn't want to disappoint their parents. However, only 14% of teens say that their parents have talked with them about prescription drug use. This is critical because parents could be playing a much larger role to increase teens' perception of risk. You can protect your family by talking with your kids who you care about from a young age to young adult. You can be clear about your expectations and boundaries, but still have a positive conversation that keeps the door open to further discussion. Some of the ways to do this is by offering advice or guidance rather than simply giving it. The phrase, "Can I make a suggestion?" followed up by asking for their feedback can go a long way. Teens can be frustrating in many ways. I know I've got two. But what you probably feel most for your teen is love and concern. Let them know that. Ask open-ended questions. Tell me about your night versus where were you? Again, it can be hard, but work to understand your teen's point of view. Let's say that your teen wants to go to a concert, but you don't want them to go. You can say, "Help me understand. Why is this so important to you?" It doesn't mean that you'll do what they want, but there's a better chance that they'll feel heard. Finally, keep talking. No matter what, maintaining some connection, even when a relationship is contentious, or if use does start, is very important. If you maintain a connection, you can always pull them back to where you want them to be. Monitor your prescription drugs at home. Keep track of how many pills are in each bottle, and if you seem to be refilling medications more quickly than makes sense, there may be a problem. One way in which prescription drug misuse can start is with sports injuries or dental work. A teen is prescribed an opioid painkiller and they find that they like it and start abusing it. Or they may have a friend who asks them to share their medication. That's why it's important for you to be in control of the medicine. Monitor how many are being taken. In addition to the signs of use we discussed before, you may also see dirty or unkept appearances, which general neglect of hygiene are strong indicators of drug use. Guys, I have to say that as a mother of two teens, some of this is just expected. But still pay attention to the signs. In addition to it, you may notice that they appear depressed or withdrawn socially. Obviously, if you notice track marks, which commonly occur in the hands and the arms. However, someone who has used for a while will inject anywhere that they can find a vein. You may find missing spoons or burnt spoons, which are used for smoking heroin. Again, I have teenagers and I have missing spoons all the time because they end up in bowls under their beds. But pay attention to the importance of stuff. You know, is money coming up missing or valuables coming up missing? They've got to have money to pay for pills or heroin, especially as those kids get older. And the best advice is to trust your instincts. If something doesn't seem right, it very well may not be right. So show concern and ask questions. So naloxone can save lives if a person is having an overdose. Naloxone kicks opioids off the brain receptors and can restore breathing and heart rate. Saving a life can be the first step towards putting a user on a path to recovery. It's the critical tool that's used by first responders, but the loved one of a person struggling with addiction can also obtain a kit and learn to use it. Good Samaritan laws provide legal immunity to companions of drug users if they act to save the life of another person. This is important because previously a person who was using drugs with a person who had an overdose would be reluctant to call 911 or take their friend to the hospital because they feared arrest. And preventing overdose can be the first step towards getting a loved one into treatment, but there's no reason to wait that long. There's a myth that a person needs to hit rock bottom before they'll be ready for treatment. Early intervention and treatment have been shown to be effective. Any stigma that exists around substance use should not prevent you from getting help for a loved one. 3 important things to do when you're seeking treatment for a loved one. Ask questions. Not all treatment providers are created equal, and different programs have different approaches. Substance use disorders are chronic and recurring. It's important to provide continuing care. There are ebooks available through the partnership that provides information on these topics. Finally, it's important for caregivers to take care of themselves. Helping a person struggling with a substance use disorder can be exhausting and overwhelming. The partnership's parent support network can provide ideas in that area. As previously discussed, one approach that has been demonstrated to be effective in treating opioid use disorders is medication-assisted treatment, or MAT. A number of medications have been developed that can reduce the effects and withdrawals and cravings for opioids. As with all treatment, different medications will work differently for different people. So these medications should be used with a treatment professional. It's important for families to understand that these medications, as well as medical professionals, some of these medications can be administered at a doctor's office, which can make them more accessible to more people. The partnership has developed ebooks on those topics as well. You can learn more about all of them at drugfree.org/heroin. The partnership has also developed a webpage where many of the resources we've discussed in this presentation can be accessed. This page will also contain links to other sources of information about opioids, including local information. If a person you care about is using opioids or any other drugs, you can also contact the partnership's helpline. The helpline is staffed by bilingual professionals who take the time to listen to the caller's concerns and outline a course of action. Callers call for all kinds of reasons, from a parent who's getting ready to have the talk with their teen to the parent of a 35-year-old who's trying to support their recovery. The helpline is also helpful to identify local treatment resources and share information about finding a treatment provider that will provide the services your loved one needs. So there's no lack of ways in which we can make a difference on this issue. The question we ask at the end of this presentation is, what will you do? If you're a parent, if you're a healthcare provider, if you're an educator, or if you're a community leader. I thank you for your time as we explore this topic. I will divulge it's not a topic that I'm an expert on, but I am a health professional, and as a health professional, I am a community leader, as you are. I don't know if y'all are aware of that, but every time you wear the scrubs out into your community, people expect you to have some answers. Therefore, whether you want to or not, you become a healthcare leader in the community that you live in. If you need any of the information or the resources that were identified in this presentation, please feel free to email me, but that's not my correct email. You can reach me at Siraj E, so there should be 2 E's on the end, at myprcc.edu, and I'll get whatever information you need. Again, I'm not the expert on the subject, but we can definitely find more information for you if you need it. Thank you. We'll now open for questions.